Complete community is a community that has everything a person needs to enjoy their lives, live, work, play, have community facilities, have places to worship, parks. So basically it would be a place where you could live and take care of all your daily needs and all your recreational needs and all your work needs in one place or one locale.
There's the various elements which are the kind of the textbook things, like complete streets or things like that, which really comes down to is having access to all various types of modes of transportation, be it auto or bus or train or pedestrian. But more importantly, the interconnectivity of those modes and their relationship to the land uses.
Well, I'm a health professional, and for me it's important that we make, when we design and operate streets, that they keep in mind the fact that people need to walk or bicycle and make it easy to take the healthy choice. If streets are designed primarily for vehicles and cars, they might not be very friendly or attractive or safe for people that are walking or biking.
A complete community is a place where someone can grow up and live their entire life without moving. All the land uses, all the services, all the transportation network has to be there for a person to live a full life. Not every town is a college town. Not every town has employment within it. Not every town is a grocery store. To provide those things, to make yourself a complete community, you can either have them in the municipality or you can have them within reach. That's where transportation comes in. And that includes transit, because not everyone can drive all their life.
And then you could take a look at it also from the land use side on the efficient land uses. You would be looking at things like what's the mix? Does it provide a full range of housing opportunities? What's the relationship in proximity to employment? What are the types of facilities that are available to the community, such as parks, libraries, medical facilities, schools, those type of things. And all those kind of make up the mix of the community, if you will, the nuts and bolts of it.
I think it's one where you can meet your daily needs without spending all your day in a car. So you may have a car, but you don't have to use it for every single trip you make. So maybe you can walk your kids to school, or maybe you can come home from work and then walk down the street to a restaurant. Or maybe you can walk to a shop to pick up a couple needed items at a convenience store, for instance. So I think a complete community will provide for all your needs in a close area without having to spend all your day driving from here to there.
And then you would take a look at, from that standpoint, how healthy and livable is it from that standpoint? Is it walkable? Does it have clean air? Clean water, clean land? What are again, what's the accessibility of the community to things like medical facilities, doctors? What's the accessibility to locally grown food? Is there a food desert in the community? Can they get good quality food? Are there opportunities for shopping for good for good nutritious food and things like that? So that's all part of the healthy and livable side of it.
From my perspective, I think as an urban planner, I think it comes down to, a complete community is a place where every member of the community can live a healthy life. So that's not just saying, they have access to a great hospital. That could be part of it, but more importantly, it really is a question of the various factors that contribute to how people can make decisions that lead to health. So, environmental factors, social factors, economic factors are kind of the top three that would influence that. So I guess a great way of thinking about it is could you live in this community from the day you're born till the day you die?
Our initial focus at NHPS has been on healthy eating and physical activity to address the rates of childhood overweight and obesity in Delaware. So complete communities are a really important part of that. You know, as a healthcare system, we're interested in seeing communities that are healthy, that make possible physical activity and healthy eating as part of daily routines. So i.e. those communities that promote active living. And that's the way that you enable children and their families to recreate together, to be able to walk, bike, take public transit to destinations of interest, you know, to walk, to bike together as a family, to be able to access healthy eating options. Those are things that are an important part of complete communities that also help to address the childhood obesity epidemic.
When you look at elements such as sustainability, what's the ability of that community to thrive, not only for the current people, but for future generations? How are they going to, you know, what's the tax base look like? What does the opportunities for the younger generation coming up? What's the employment mix?
A complete community to me is one that allows for a variety of inclusive housing options, as well as access to goods and services and multimodal transportation options for all residents regardless of age or ability level. It really takes into consideration a universal design approach which looks at usability holistically and takes into consideration a variety of human factors and integrates features into the environment that have convenience, ease of use, and safety for all members of that community. Complete communities to me are also multi-generational, so it meets common needs and interests across generations. And by doing that, you're then providing for a sustainable community that meets needs for future generations as well.
And then if you looked at the, I guess the other element they always talk about in complete communities would be resiliency. Can the community grow? And more importantly, can it change? Because all communities change over time. The demographics change, the economics change, even the environment changes sometimes. So what's the ability for that community to be resilient and to adapt to change, you know, in a very constructive way?
I think really it's about the walkability and bikeability is important, but it's also about the economic development and the destinations and the feeling that you are somewhere and that you can get somewhere. You know, if you have sidewalks without any type of landscaping, it's not as attractive as a walking environment with the street trees and things. So
we need to mix land uses, so we need to mix commercial uses with residential uses and to some degree industrial uses, so we create employment and provide for walkability, a mixed transportation mode, if you will, so that people could walk, ride bicycles, rely less on automobiles than on mass transportation. The big goal for complete communities, the big ideal should be full occupancy, where we can sort of roll with economic changes without losing occupancy levels, because full occupancy really creates a stronger community by increasing prices, reducing crime rates, lowering the cost to society, if you will, by elevated police costs and renovating broken down properties and things of that nature. So I think you sort of stabilize through ups and downs in economic trends.
The complete community comes down to two keywords: accessibility, and that's both physical and financial, and then choices, and allowing people the choices they need throughout the course of their life.